All right, so if you've ever been to a chiropractor, thinking about going to a chiropractor, how exactly does a chiropractor do the adjustments, what happens during the adjustments, and how does a chiropractor know when and where to adjust the spine? So first thing you're going to look at is going to be the tone of the muscles, whether there is a muscle spasm, muscle contracture, or a chronically fatigued muscle will also feel a little bit different than one that's in an active spasm. The second thing we're going to assess for is the motion between each vertebrae. Now, this patient's set up for thoracic adjustment, and thoracic spine is known for having very little mobility compared to the upper neck area or the lower back area as far as how much range of motion every single joint has. Okay, so you're going to feel and assess mainly the joints called the facet joints. And the interesting thing about the facet joints is it is a what's called a synovial joint. So you have a synovial joint, that's your big hip joint there. The glenohumeral joint, which is the main shoulder joint, that is also a synovial joint. And all that means is one joint surface meets another surface and it's surrounded by a fibrous capsule. Okay, so when you have that popping noise or that popping sensation, what's happening is that capsule is decompressing. Okay, and then you hear that popping sound. Okay, as far as how the adjustment occurs, you're going to assess the range of motion wherever that patient either has a rotated vertebrae or is lacking movement between there. You're going to implement a force that re-energizes that joint and gets that proper motion within that joint. Okay, and that popping noise is just that synovial joint in there. As far as how we know where and what direction we need to go, it all depends on the angle of the joint. So up here, each patient's a little bit different as well. So I'm going to go more of a force this way. If I need to adjust these joints down here, I'm going to come back and do it more this way. If you were to adjust like the lumbar spine here, this patient would not be very happy because you're going to be jamming those joints and it's not going to feel comfortable at all for that patient. So that's how chiropractors know when, where, and how to adjust. You can also use x-ray or some advanced instrumentation, those sorts of things. Every chiropractor is a little bit different. Okay?